Live. Good afternoon, everybody. I'm Dr. Deanna Minich. And as you probably know and you've been aware of, the American Nutrition Association has been doing a series of live chats with a number of different experts. Initially, we were doing a number of different talks on on COVID-19, talking about immune health, and we're going deeper into that discussion. And this is setting the stage for our conference on immune resilience coming this November. It'll be a virtual conference. So today's guest is going to be talking with us about Lyme disease, which is an incredibly hot topic. There are lots of different orientations and perceptions of Lyme disease out there. So we are going to get the facts from Dr. Fishman. And let me just read you a little bit of a background about Dr. Fishman. He is board certified in internal medicine and a certified nutrition specialist. That's a beautiful combination just off the bat, right? To have a medical doctor who knows about nutrition. He focuses on evaluating and treating individuals with complex, often undiagnosed, persistent conditions. While his focus is on the medical aspects of diagnosis and treatment, he integrates both nutritional and immune support methodologies in his clinical practice. A current focus is the epidemic scope and nature of chronic infections and inflammatory consequences of tick-borne illnesses, including the persistent Lyme disease complex. He expanded on his training at the University of Illinois Medical School, which is my alma mater, with a residency and fellowship in internal medicine at the Mayo Clinic, and he spent more than 50 years as a clinician in private practice. So welcome, Dr. Fishman. Really a delight to have you here today.
Thank you. It's like to be here.
It's lovely to have an expert to talk about the interface, the medical and nutritional interface for Lyme disease. So I would say, let's start with the basics, because so many people have different takes on what Lyme is. And so let's talk about the physiology. Let's get back to the basics of somebody is bit by a tick. What kinds of ticks? Are all ticks created equal? Do we need to be concerned with all ticks in the same way? Perhaps you can walk us down that path and have a better understanding for all of us as to what that involves.
And well, basically, what we're dealing with is ticks that are present here on the East Coast. Lone Star tick is a new introducent, and what ticks do is they're feeders. They want to feed off of our blood system. They're designed to feed on us. It's a slow draw, and they'll feed on us for about 3 days if we don't realize they're on us or we feel them. So often tick bites don't hurt, which is why so often people can get infected and not realize it. If it's just a tick bite, tick's not infected, okay. You have a bite, it's like having a mosquito bite in a sense, it's not a big deal. But more and more we've been seeing over the last several decades, the ticks have been getting more infected. And what happens, just like the analogy would be malaria mosquito, is the tick can carry organisms, microbes, and while it's taking its blood meal, it will inject the microbes that it carries, and it'll get in the dermis, in the immediate dermis and blood skin, and the microbes themselves will then try to escape, get into our capillaries, get into our lymph system, and get into our entire system. And when you hear the term Lyme disease, this originally was discovered back in Lyme, Connecticut. That's how it got this interesting name. And it took a very intelligent housewife to realize something was going on in her small area, neighborhood. 6 young girls supposedly had a rare disease called juvenile arthritis. That's not supposed to happen. It turned out they had some arthritic pain. She contacted the CDC, got people out, and they realized that actually this was not arthritis, but it was an infection. And at a later time, and it was tick-borne. And another studier, Willy Bergedorf, discovered that in the tick was a spirochete that we now give the fancy name of Borrelia burgdorferi. And this became the so-called cause of Lyme disease. So this is an infection delivered. And what happened is that over the years, this infectious process has been increasing in amount. Even the CDC recognizes a tremendous increase. It's very prominent along the East Coast. I'm in Virginia. I was in Maryland. It goes up all the way to Maine. It goes down into the Carolinas, probably even into some parts of Florida. I originally came from Chicago. It follows the rivers, the bird trails. So it follows the Appalachian trails where the birds go, because they often carry the ticks, so it goes to new areas. It follows the Mississippi River, so we see it in Illinois, Minnesota, Wisconsin, and down that way. And as I understand it, it's in the Northwest, probably Northern California and up, are common areas. But the only area it's not common in anymore are desert areas and high mountain areas. And what it does, it's become very confusing to people, to doctors, and controversial, as you may have touched on, is what's this all about? So certainly, understanding the physiology, well, what happens when you get this bite and the tick delivers the microbes? But let me touch first on, here's the person who just got the bite, and then we'll sort of go interior and see what happens in them. And they're stuck with often confusion, controversy, because there's different stories. And the reason is this is what I've deduced, is there's actually two major books about the understanding of Lyme. The first is called a storybook, and it's found in a lot of medical texts, especially medical texts for infectious disease, and it has tales about Lyme disease. Sometimes you'll read these tales in the New York Times health section. And then there's a second book, and it's called The Book of Life. And the title of this book is called Reality. And reality is based on observation and deduction. And sometimes it takes a good while and a lot of people to do these observations and deductions. And it tends to come up with a little different story. So there's a tale about how Lyme behaves, how it's supposed to behave. And then there's the reality of how it behaves. And that's where the confusion comes, both for the person having the disease and for the people they go to get treated for the disease. As far as, well, how does it determine how they're going to be treated, how they're going to be diagnosed, and there's lots of confusion. Let's start with what happens when you get bit. So you've just been introduced with an alien. And the reason we're all still alive and standing on the planet right now is because we have this wonderful defense system we've been given called our immune system. And it is a defense system. It has several jobs, but the key one is to recognize when an enemy has entered, when it's been invaded, and to respond to it, and to deal with the invasion, hopefully to eliminate the invaders. Sometimes we have two systems in that immune system that are key. The first is called an innate immune system, and that's what's going to be that first responder to the bite. And the innate immune system will attack anything that it determines is an enemy. And the way it determines that is the different, mostly white cells, neutrophils, mainly lymphocytes, are coated with what's called receptors. It has proteins on it. They're sometimes called, a good group of them are called toll receptors, and they're designed to recognize foreign protein. And when the foreign protein is recognized, it hollers enemy. The innate system doesn't know who the enemy is. It doesn't care. What it's designed to do is go after what it determines is wrong. Sometimes, interesting, the enemy could be even internal. It could be a cell that's been damaged, some debris, but especially here, we're going to go after an infectious agent that's coming in after us. And what it does when it has this response is it triggers chemicals. You may sometimes read about NF-kappa-B. I call it the Paul Revere because it gets the alert, the enemy is, the redcoats are coming, and it turns on a whole slew of chemicals called cytokines. And these are chemicals that the immune system cells produce that are designed to go after whatever the alien protein is and destroy it through inflammation. And inflammation is what we experience when we've just been attacked. If we get a red area, a sore area, that's inflammation. That's the immune system saying there's something bad here and we're working to get rid of it. And that's a war, and war is uncomfortable. Hopefully, like if you ever get a sliver, that's inflammation. You get the sliver out, the redness goes away, it heals. And the other aspect of the immune system is to not get overzealous and begin to clear up once the war is over, to clear things up. And the other half of the immune system is the part that deals with who specifically just attacked us. We might call it the acquired immune system. And it can create, it's called B cells that can create antibodies, and these are matching proteins to the abnormal protein. And they help neutralize the abnormal protein. They neutralize who has the abnormal protein, and also can give us memory, so that whenever this spirochete shows up again, we didn't know who it was first, but whenever it shows up again, we're armed and ready. We don't have to make a template. We know how to get it. So the response is immediate, but the acquired system takes a little while to come on board if this was a naive infection. And then wherever the infection, the organisms have taken place, symptoms arise. Just to touch on symptoms, inflammation causes symptoms. And symptoms are the response, and the inflammation occurs where the immune system and the organism are meeting, where the conflict is. And where it is can determine what the symptoms are. So I find Lyme to be the greatest teacher, unfortunately, for patients who have it, of how our immune system works, when it's good and when it's dysfunctional.
Yeah. And thank you. That's a beautiful description of the parts of the immune system and how we have this internal defense in order to recruit that internal army to take on something like that, like a pathogen. Now, one of the things that I think about, so I grew up in the Midwest. I'm from Chicago, and I spent a lot of time outdoors. And I think about, gosh, I know at some point I was bitten by a tick and even had some exposure to ticks in just being in a forest preserve or camping. So why doesn't everyone get sick from being bit? Is it because the tick itself did not have the infection? And as you're saying, there are increased rates of infection. How do we know if we might be susceptible to a tick-borne illness?
I think we're all susceptible. You know, it's like the virus we're dealing. It's yes, if you get it, you've been infected. It's an infectious agent. However, one thing, and if we go back 20, 30 years, there were less ticks infected. So even if you got a tick bite, you know, it's a matter of statistics. If 50, 75% of the ticks are infected in areas now, if you got a tick bite, there's a really good chance you got it. If only 15% were involved, then you probably were lucky. That's number one. Number two is your own resilience. You know, your immune system is going to encounter it. And I suspect that early on, a lot of times if you didn't get a big load of organism, your immune system may have been able to tackle it and maybe clear you without you even knowing that you really got infected. Or you may have gotten a very pathologic version of the spirochete and they can make you really sick. Or your immune system itself may not have been up to snuff. Sometimes genetically, you know, we're all mutants, okay? None of us got the perfect set. Some of us got a little better set in some places, and some of us got weak spots that we got away with until we got tackled. And so I think your own immune system capability of fighting the infection, and then what also supports immunity is what was the lifestyle you were leading coming into this. You know, people who have been keeping nutrition, lifestyle up have a better chance. However, that doesn't give you perfect immunity, because I have people who've led the perfect life, okay, way better than I ever would have, and they get sick. And I have other people, it's a wonder why they didn't get more sick, okay? So the answer is there's a lot of chance involved, randomness. It's like all things. Some of us are made stronger and more sturdy than others are made. Some of us are more sensitive. Some of us are more tough. Some of us are fragile, whatever. So I think it plays a different role. Compounding things, and that's where I think we're seeing more of this, and it's an interesting topic with Lyme, is the tick is dirty, and I don't think people just get the spirochete. In fact, clinically, I call Lyme whatever the tick gave them. So commonly, I'll see people who have a second organism. It's a protozoa, interestingly related to malaria, called Babesia. And a third organism that doesn't get much attention, but I think is the most stealth of all, and it has about 20 different species, and it's called Bartonella. And as a clinician, understanding all of this is key to diagnosis, because these different infections that come in with the spirochete give different symptoms. And sometimes you can get a clue as to what's going on.
So how do you diagnose patients? Are there certain lab tests? Are there certain, of the people I know who have had Lyme, many of their conditions have been related to the neurological system, having neurological dysfunction, headaches, things that you can't explain just from any other exposure. So I'm curious in terms of what are the symptoms, what are the assessments, are there antibody tests? If you can talk with us about that process of trying to make sense of whether or not we have been exposed.
I think the keys with diagnosis is number one, suspicion. And I'm suspicious of everything in our area that pays. And number two, sitting down and taking the history. And taking a Lyme history, and I mentioned there were two views of this. And the second view, of what I'll call the reality view, is that Lyme can become persistent, even if you were treated. The tail of Lyme says that Lyme is hard to get and easy to treat, and the spirochete is a wimpy organism. And the reality message says that Lyme is easy to get and hard to treat, and the spirochete is one of the most stealth organisms on the planet.
Huh.
And so being suspicious of it, and also the tale is that if you get 2 weeks of, say, doxy, you've cured it. It's like getting 2 weeks of chemo and you've cured your cancer, okay? That doesn't happen necessarily. So often you can get Lyme, you can get better because you've been treated. It goes quiescent, and then we can talk about how the immune system allows that. And then if you get insulted or stressed extremely, it can show itself again.
Okay.
Also, there's no good immunity to Lyme. So you can get Lyme number 2, even though you had Lyme number 1. And if you get Lyme number 2, you get it really bad. It's more explosive because your immune system was already armed. And that was the other point. So Lyme, there's two versions of Lyme just to touch on. There's a Lyme where your immune system is naive. It never saw it. I call that, interestingly, it's commonly called acute and chronic, but that doesn't fit. I call that virgin Lyme. First time, never had it before. And the system is naive, it's a different response, softer. And then if your system has already been trained on Lyme, you're now dealing with Lyme number 2, which is a reaction to Lyme, more explosive. It'll react to a new Lyme, it'll react to the old Lyme you didn't know you still have. And as far as diagnosis, Lyme, another spirochete deals with syphilis called the great imitator. Lyme is the new great imitator because wherever the organism goes will give symptoms. So common symptoms people get that they dismiss, don't realize they have Lyme. I'm a little fatigued. I'm just getting old. Like I just got old all of a sudden. Okay, you don't get old all of a sudden. I'm a little forgetful. I got some aches and pains, but everybody has aches and pains. When it gets in a real bad area, and this is the toughest area of all because it affects your cognition, affects your mood. So Lyme can cause all kinds of neurologic symptoms, peripheral, funny feelings in the nerves, especially if they come and go, that's diagnostic. If they're weird and don't fit any template that the neurologists have in their book, that's probably Lyme.
Dr. Fishman, what you're describing too makes me think of mold toxicity. How can you delineate clinically between being exposed to mold and mycotoxins versus Lyme? Because so much of that symptomatology, there's kind of some overlap there.
So you've just realized how complex this is dealing with Lyme. Why doctors don't want to deal with it. Because that's absolutely true. Because one of the compounding factors, we just mentioned immunity, is, and I use war analogies. What if your immune system has 2 wars going on at the same time?
Right.
Literally. It's in one war it was getting away with, could have been the mold, interestingly. So I got chronic sinus, I'm getting away with it. Now you get Lyme, and now that's the big war. Your immune system sort of crashes on it, and you really get sick. And the symptoms are all the same: fatigue, nervous system, achiness, I just don't feel good, misery. It's almost spiritual. People lose their spirit. when they have this. They get malaise. It's flu that won't quit. We can spend another half hour on the presentation of it. So, and then another one, the third agent that causes trouble is gluten. Celiac disease is uncommon, okay? Gluten sensitivity, I see a whole bunch of. It's not the genetic version, but they're sensitive to it. And I eat it and I don't feel good, but I'll keep eating it because I'm addicted to it. And that aggravates it. And so having to recognize all those aspects and trying to deal with whatever's easiest to quiet down first is key, because your immune system is now overwhelmed with all these jobs.
Do you think, just a question about the gluten, the non-celiac gluten sensitivity, do you think that that complicates the interactions with the immune system and then creates an additional burden, and so then you're less effective? Is that
Absolutely.
kind of the tie-in?
And
okay.
What's good about that, if you have it, is it's simple to get rid of, but not easy.
Yeah.
Yeah. Don't eat it.
You just have to commit to it, right? It's,
yeah. I say, yeah, I don't eat it. You're going to have to lock me in the closet. I'm going to eat it.
Exactly.
So the answer is, but if you can put that aside, that's one burden taken away. Mold's a little more difficult. And the co-infections are more difficult. So it's like your immune system has got a plate full, and the question is, who does it tackle first? And when symptoms come, as far as picking, I think homeopathic people have taught us, the immune system will present symptoms of who it wants you to tackle first, as far as which organism do you go after, or which thing do you try to quiet down. So in diagnosing it, suspicion, I have to spend at least 1 to 2 hours with a new patient because they're complex, they're chronic. I'm not seeing the brand new naive Lyme usually. I'm seeing the people who've been sick for 10 years and told it's chronic fatigue or fibromyalgia, or they're just neurotic. And I'm seeing strong people because they say, wait a minute, they fire their doctors, okay? They say, something is wrong with me. I don't know what it is, but I know something's wrong and I'm going to find someone. So that's what they go after. And so I think the key is the story, and then testing. And the CDC designed testing that Quest does, LabCorp does, Mayo Clinic does, my alma mater, is ineffective. It's not sensitive. Lucky to pick up half the cases that are really there, because it's measuring antibody response to the organism. There are private labs out there. One in Palo Alto, there's some on the East Coast that are doing a far better job of testing, but you got to know about it. It's private, it won't be covered by insurance, but if you're sick enough, you'll do whatever it takes to find out. And testing is real important, but paradoxically, my sickest people have the least positive testing, and my wellest people, because you can be fairly well and have Lyme and hardly know you have it, have the most positive testing as a rule, because it says we're measuring immune response. And the people who have a strong immune response usually are, I'm using the word weller. And the more fragile people may actually have a negative response, even on a really good testing. So a negative test, even if you did a good one, never says you don't have it. It simply, you can't prove a negative. It simply says, I didn't confirm you do have it. But if your story is good enough, and there's been no other, you've seen 15 doctors, and no one has an answer for you. If with your consent, I'm willing to start a trial of treatment to see if we have it. And the trial of treatment is back to integrative approach. I initially start them on support for their immune system, for inflammation, for detox. We look for what needs to be replaced for them. Do they have a methylation issue with B12? Do they have a zinc deficiency? They all have vitamin D deficiencies, okay? We look for all that, and I'll start working with supporting that, and I'll put them on some antimicrobial herbal tinctures, something like cat's claw. Before I even go to antibiotics, because I need to get more information from testing. And also, because people have been sick a while, they become oversensitive. So as you start treatment, you can knock them off their feet. Mm-hmm. Somebody's called that a Herxheimer response. Mm-hmm. So the question is, who's sturdy and who isn't? Because with the more fragile people, it's a slow war. It's a Taliban war. It is not a Germany war. Is you hit it with everything, but when it's over, it's over. A Taliban war is lots of luck. You have to sneak in. You don't hit it hard. You have to walk in, sneak in. They're stealthy. And you may not reach a cure, which means nobody's left. You may reach tolerance. And that's okay. Tolerance is, I can get on with function. I'm not 100%. I'm only 85, but 85 is better than 25. And the answer is, yeah, I'll accept that. Because when people have been at 25%, and some of these people are, they have PTSD. They don't want to go back there. Sometimes
Right.
it's hard to get them off antibiotics because they're afraid of going back.
And that's one of the discussed modalities for Lyme disease is a course of certain antibiotics, as you previously mentioned.
Absolutely. In fact, that's actually often necessary, but not sufficient. So lifestyle, the nutritionals, but and 2 weeks of antibiotic is not going in 2 days is not going to. If first of all it's not naive anymore, it's not going to be even 6 weeks. For the first case, 6 weeks I think likely will cure about 75%. Once it's a chronic persistent infection, it may go 6 months, it could even go 6 years. But where they've been 6 years is acceptable, except for where I've been.
Yes. Again, such good information, and you being in practice for 50 plus years. I mean, this really shows
it's crazy,
your
isn't it?
wisdom and how you brought all of these things
Even
together.
myself.
So I'm curious, with somebody being on antibiotics for such a long course, are there symptoms or side effects relating to that long duration of being exposed to antibiotics? How are you taking care of the gut with these patients? Is there a way to do that concurrently?
Key and interesting, of course, working with probiotics, if they're getting into yeast issues, working with issues with candida. But amazingly, if you take some precaution, what I'm finding is it doesn't happen a lot. It can happen and it can be devastating. You have to watch for C. diff, but luckily that's rare in my experience. Doesn't mean you don't be aware of it. What happens though on the long term, and I hear about what they do to the mitochondria, but you need to sit down with 25 people who've had chronic Lyme. It's like treating cancer with chemotherapy. Why would you use chemotherapy for all the terrible things it does? And the answer is, it's better than cancer.
Right.
And the answer is, okay, that's what we do. In Lyme, in the persistent long-term Lyme, sometimes it's required to get it down so the person can get back to, the question is quality of life. And quality of life is, can I get back to being basically who I was, and can I get back to functioning?
So with 100, let's just take theoretically 100 Lyme patients, and I know that you've treated so many patients over the years, but let's just take 100. How many of them can you bring back to at least, let's just say, a 70 to 80% quality of life level? Because you were talking about 25% improvement, or that's where they're at. How many of them do you get up into that quality?
About 3/4.
Okay.
I still have some people, yes. And that's what keeps me doing this, because we're talking to people who've been out of, I had a guy, he's a professional soccer player and he's in bed. I've had, I had someone who is like a Navy SEAL, and we can get them back. Yes, sometimes it's limited, and we have some cases that it's just been tough, and we just have great trouble getting to the final solution. They're better than they were, but they're not good enough. But they're just better.
Do you think that they're not getting to that higher level because they have other maybe viral loads, other infections, other co-infections that are really complicating and again, increasing that immune burden?
Every day I ask myself, what am I missing? And why am I missing? And I think there's another factor, you get into the spiritual, a mind matter, mind brain matter. What is their past experience, PTSD, not from Lyme, but from whatever life experience there. What are their toxins? If they have a heavy metal load that we're not picking up on? There's all these other infections. Other insults, who knows whether it's spiritual or what. Why is it that they can't get well? And I'm not blaming the patient, okay, because the people we see, I have a cash practice. They're coming on their own to get well. So they're fighters. My people are warriors, literally. Nonetheless, there's something not letting us solve the problem. And it could be immune deficiency. Some of our people have had to go on IV immunoglobulins because they just don't make enough antibody. That's a genetic natural issue for them. So I think there's reasons, and I don't know all of them, that why we can't get the others well. But I think the key is not telling these people it's post-Lyme. That's why we don't, I can't tell an Alzheimer's patient, you have post-Lyme, don't worry about it, everything's okay. It's often persisting Lyme. And
Yeah.
that's why it should be continued to be addressed with whatever. Even if you end up using nutraceuticals as a primary thing in herbals, at least they're better.
Let's talk about that, Dr. Fishman. I'm curious, with the American Nutrition Association, we do talk about personalization, but there may be some steady Eddie go-tos in our clinical toolkit that we might always come back to for these types of conditions. Are there some go-tos that you find for most patients, it seems to be beneficial, whether it's berberine or whether it's zinc or whether it's vitamin D, certain probiotics? Are there certain things that you seem to always go to because you've just found that time and time again, they seem to work for most people?
What I generally have to include, first of all, my Lyme people are, many of them, the great majority of them are vitamin D insufficient or deficient. And what I call sufficient is not 30. That's like poor.
Yeah.
It's 60, 70. If we're measuring nanograms. I know they're measuring it new ways now, but measuring nanograms, getting it up there. I'm finding the great majority of people are what I'll call zinc insufficient. And I think Dr. Walsh has pointed out, you want to see a zinc level of 90 nanograms, not just 50. What's interesting about laboratory tests is those values were developed on sick people.
Right.
So they say, well, this is normal for a sick person. What's optimal? And so optimal vitamin D, optimal zinc, I think this great majority of people who have methylation issues.
Yes.
So I think whatever you're discovering that they're lacking, that's obvious to get to. I think anti-inflammatory, all the phytochemicals, all the flavonoids and such, I think are key. Dealing with inflammation, omega-3 fish oils are key. Probiotics are key. Selenium, get into even the other vitamins, vitamin A, vitamin E, and getting the right versions of it. What happens in over-the-counter things is who's the company? How do we know the quality of what they're taking? Obviously, eating good is good, but when you're sick, sometimes I think you have to go behind just eating. You need extra supplies. You're dealing with deficiencies. You're dealing with much greater need than just normal maintenance. So that's why we'll often use a lot of nutraceuticals. But I think anti-inflammatories, detox agents, antioxidants. You had this great list I saw on the webpage, and the answers, I agree with all of them.
Okay.
Because the answer is yes, they all play a role, from the catechins on, and all the fruits. Absolutely.
Yes. And you mentioned so many important things to be thinking about, especially detoxification. You've mentioned methylation now a couple of times. And methylation, especially if we are inefficient at it because of a gene variant we have, we might need more of certain vitamins. So that needs to be assessed by a healthcare practitioner who is skilled in the art.
Correct. Looking at genetics, looking at how to measure, and looking at the proper form, like in B12, are we giving it in a methylated form to be more effective? And also working with the patient, because we don't always get the same response from the same treatment. Back to the individuality, and trusting that the patient knows how they feel. They say, well, it's subjective. Yeah, pain is subjective, isn't it? But when you have it, you have it. So let the patient talk back to you as to what sometimes they will clue into something that works for them that doesn't commonly work for someone else. And the answer is, great, if it works and it's not harmful, go for it.
Gosh, I wish I could have you as my medical doctor. I mean, the wisdom to think that, you're trained in allopathic medicine, and yet you see the benefit of nutrition and lifestyle with respect to the immune system, but you're seeing the system's web. You're seeing what we talk about in nutritional medicine all the time.
That's key to understand why. The question I keep asking is why. First, what are you observing, not what you were told. Sometimes your lying eyes, we're going to tell you about Lyme, don't believe your eyes. And then and then finally, once you know what the what is, why is this going in? We'll sometimes see weird symptoms. The question comes, well, why is that there? And then, of course, and what do you do about it?
Exactly. And keep asking the why, the root cause. Dr. Fishman, this has been fantastic. It's
thank you.
as we can tell, this is just a small window into your vast knowledge, and I really do appreciate you spending some time with us.
Well, what became on a mission of, I never thought I would have a mission, is that as I'm seeing what's going on in Lyme, I'm seeing the problem it causes, the great number, is how to get it out. It's like what I've been seeing, and I've learned from other people, I've had mentors, is how none of it's proprietary. How do we expand this? Because there's a world of sick, chronically ill people who actually don't have to be there. They can be made better. How do we get that out?
Are there certain references or resources or things that you believe give people good information about this topic?
I think, I've been a member of the organization called ILADS, ILADS. That's a group of Lyme literate doctors that gets into a lot of the treatment, medicinal, pharmaceutical approach, a little less into the nutraceutical approach, but at least getting awareness of how to diagnose better, how to look at symptoms. I don't think the concept of persistent Lyme has been fully accepted generally, and I think that's key for understanding chronic illness. And also, if the infection is persistent, the helping people have to be persistent, likewise, as is the patient. Patients get frustrated, and also we healers get frustrated when things don't get better fast. But you keep working at it.
That's true. And, there is kind of that equation of how long we've had something and then how long it will take to go away. So I would think that if you're bitten by a tick, the sooner you work to remediate that, the better off you are versus waiting for a long time. But some people, you just don't know what you don't know. And perhaps you were bitten and it has long-lasting effects. It's no longer a naive infection. It's now in your adaptive immune system. And most people don't connect those dots. So this is one of those things I think under the hood of our health, most people aren't aware of, quite frankly.
That's actually key. And what happens where your disease has been sort of tolerant is often I'll take a story and I say, well, you suddenly changed. What happened? And they show nothing. Oh, yeah, the dog ran away. I got divorced. I lost my job. Nothing happened. A sudden stress or a sudden trauma could be the trigger to the immune system crashing to allow the tolerant infection to now become a pathologic infection.
Yeah. Well, and I'm hearing that through the lines of what you're saying. You're talking about spiritual reasons for illness. You're talking about stress, talking about lifestyle. It's another complement to nutrition. Yes, we can do all of the supplements. We can eat right as best as we can. But there are other things that we need to be really looking at, whether it's our sleep, our sense of community, our sense of stress. I mean, all of these things we know impact the immune system greatly. Including
exercise. Sleep is a biggie. And it's a vicious circle because sometimes when you're sick, you have lousy sleep.
And you don't have the energy to exercise,
and just being sick is stressful. So it's how do you get at it? So you start with wherever you can.
Yeah. Thank you. That's so inspiring. And I'm sure that somebody listening to this today, whether they know somebody or whether it's themselves looking for a solution, and to seek out a physician who is truly trained in Lyme and as
That's
part
key.
of that lifestyle medicine and nutrition.
Correct.
Wonderful.
Well, it's been good sharing with you.
Thank you.
Sometimes to get it out.
Yes, absolutely. And that's really the goal of these Facebook Lives, is to better inform our audience. And I'm really excited for the conference in November because we're going to take this head on and get squarely in the face of the immune system and all of the different challenges and things that we can be doing.
Super.
Yeah, so thanks
Doing
everybody.
Good work.
Thank Dr. Fishman again, and also let you know that we're continuing to do these talks on a monthly basis. If you go to the website, theana.org, you can see a list of resources. You can see a lot of the other videos that we put out. And so we're excited to have you as part of our community. And I would say to check back in with us. Lots of good information coming through. So thanks, everybody. Thank you again, Dr. Fishman.
Bye.